Good morning to Dallas County Judge Clay Jenkins, one of the most visible people in dealing with this ongoing crisis. So no need for the convention center actually sounds like good news. It sounds like the plans worked out the way they were supposed to.
Yeah, that's right. The current models hold because of the great work that the people of North Texas are doing in making good personal responsibility choices and following the safer at home order. We won't need to open that unit. There'll be enough beds in our hospitals, they're already built here in North Texas. So that's very good news.
10 deaths on Tuesday, which is sad, but as Dr. Wong pointed out, those are people who were probably infected a couple of weeks ago. I suspect we're going to hear more similar bad news today.
Well, I don't have the totals for today. But yeah, we're still on the upward swing of that curve, and so we'll see more people die. Every death is regrettable. We're having so much fewer deaths than we were slated to have, even back in the last week of March. So March 22nd, when we went into the safer at home model, it was projected that at our peak we've had 1,700 people in the hospital, or I'm sorry, 17,000 people in the hospital from this. And now it's projected that at our peak that might be 500 or 600. So it's really paying off what you're doing.
Yeah, we are behind in the peak, behind places like obviously New York and Seattle, which may have already peaked. The danger of talking about the peak is that some people hear that and think it's time to slack off.
That's right. And it's so important that you stay the course. We've all sacrificed so much being at home and limiting our activities. And we don't want to give up now and waste that sacrifice and have to do this all over again. So just stay with us on this. Keep doing what you're doing. You're
calling for more testing and more rapid testing. Why is that important? The open test, the drive-through testing centers are not even reaching their daily capacity. Is there really a demand for more testing at this point?
There's a need for a lot more testing, particularly in places where folks are uninsured. And there's a need for testing to turn around a lot faster. So those drive-through test facilities, you got to wait 7 or 8 days to get your results back. We need tests that turn around in 1 day. We can do that. UT Southwestern and Parkland have spent the money and put in the time to build the capacity. Now we need what's called the reagents, the materials from the federal government to be able to do that. We'll even pay for them. It's just a matter of getting a supply. And if we did that, suddenly you'd have the ability to do 6,600 one-day tests, whereas currently our one-day test capacity is a little over 100.
We're still waiting for the materials to do the volume of testing that we need. That is almost unbelievable. Dallas County Judge Clay Jenkins, thanks for some very long hours you're putting in on behalf of the people of the county. We appreciate it.